The Better Sleep Explained virtual event.
Next up, we have Sonia Cardozo. Sonia has worked as a registered respiratory therapist in both the hospital and home care settings for the last 6 years and has a strong passion for education and teaching. In her current capacity as CPAP supervisor at Wellwise by Shoppers, Sonia provides direct patient care as well as clinical support to CPAP consultants in the GTA. Welcome, Sonia.
Thank you for having me, Natasha.
Thank you so much for joining us today. So the first question I'm going to ask you is, how much sleep do we really need?
Yes, so personal sleep needs really depends on the individual as well as their age. However, most sleep experts say that we should be getting anywhere between 7 to 9 hours of sleep. But there's two main universal factors that really determine our sleep. So one of them is our biological clock. So that is that internal timekeeper that regulates the hormones that keep us awake and asleep at night, and our sleep drive. So basically that is the principle that the longer you are awake, the stronger your drive for sleep will be.
And so what happens to our bodies and our health if we don't get enough sleep?
For sure. So of course, sleep is very crucial to our overall health and our well-being. When we sleep, our bodies restore themselves, they repair themselves, we manage our hormones, we flush out toxins, and we also file our memories. So of course, without good quality sleep, a lot of negative consequences can occur, such as increased risk of developing heart disease and stroke, as well as cognitive decline.
And so when we just spoke to Dr. Gorfinkel, and she mentioned that anyone can be affected by sleep issues, but do sleep issues actually get worse as you age?
So not necessarily. There is a public health statistic that says 1 out of 3 Canadians under the age of 64, as well as 1 out of 4 Canadians between the age of 65 and 79 are just not getting enough sleep. But there are definitely a lot of factors that aging Canadians do face, such as chronic pain, increased sedentary time, stress, insomnia, as well as untreated sleep apnea.
Which we will talk about later.
Yes.
So would we look at the quality versus quantity? So if I'm getting 7 hours of sleep and it's really good sleep versus 10 hours of sleep where I barely hit the REM stage of sleep, like is there a difference between the quantity and the quality of sleep?
Absolutely. So like I'd mentioned, experts suggest that we should get anywhere between 7 and 9 hours of sleep. However, practicing good sleep hygiene is what is going to get you good quality sleep. So just a few things such as, going outside every day, getting sunlight. Daylight really helps to regulate a healthy biological clock. Limiting napping during the day, so less than 30 minutes a day is recommended because that will then affect your nighttime sleep. Avoiding stimulants, so nicotine, caffeine, any type of alcohol should be avoided, as well as large meals, because if you're eating too close to bed, you might have upset stomach or indigestion, which will affect that. And lastly, which is one that we are all guilty of, is limiting that phone or screen use. Trying to avoid that cell phone or the TV before bed, because the light that is emitted definitely disrupts those hormones that help us to relax and fall asleep.
And what do you do to get a better night's sleep? Like, what is your top thing that you do?
Absolutely. So I think the one thing that I do try to do every day is sticking to a consistent sleep schedule. So trying to at least go to bed around the same time and wake up at the same time every day. By keeping that consistent, that will make a huge impact on your quality of sleep.
And so summits like today are providing a lot of information for people around sleep. But even after this summit, like, where can people turn to get information about better sleep?
Of course. So obviously, our CPAP consultants at wellwise.ca, we have a wealth of information regarding sleep as well as sleep apnea. Wellwise.ca has a lot of information there as well. And of course, reaching out to your family doctors. They're a really great resource for everybody.
So the next question I have for you, I kind of already know the answer because my husband has this, but could you tell me, what is sleep apnea? Because it's certainly a term that people hear all the time, but what exactly is it?
Yes. So sleep apnea is a potentially serious sleeping disorder where our breathing repeatedly stops and starts whilst we sleep. And of course, that's not a good thing because when our breathing is stopping, it affects our oxygen levels. And then it puts our body in this state of stress or panic. And of course, that will then affect our sleep and give us sleep interruptions and poor quality sleep. But also there are kind of two main types of sleep apnea. There is central sleep apnea and obstructive sleep apnea. So central sleep apnea is where there is an interruption in the brain signals that stimulate the body to breathe, which causes a breathing pause. And obstructive sleep apnea is probably the most common, where our surrounding muscles of our throat collapse and they create an obstruction and create a pause while we're sleeping.
Yeah, I was actually shocked when we had gone to see my partner's family doctor, and he said that he stops breathing like 40 times a night, which is terrifying. So what are some of the signs and symptoms of obstructive sleep apnea?
Yeah, so some of the probably hallmark signs that we see in a lot of our patients definitely is loud snoring.
There was a lot of that. Hear it from the next city.
Yes, I think a lot of people say this. There is excessive daytime sleepiness or fatigue. Sometimes people will say they wake up with a headache every morning. Even partners witnessing their partners having breathing cessations, as well as waking up with a dry mouth or waking up kind of gasping or choking for air.
And so what are some of the risk factors? Like, I think there's certain types of people who are more susceptible to sleep apnea. So what are some of those risk factors?
Yeah, so some of the main risk factors would be obesity, so a BMI greater than 30%, a diagnosis of high blood pressure, having a large neck circumference, as well as even just a family history of obstructive sleep apnea.
Yeah, I remember when I was telling a friend of mine who's a physician that my partner has sleep apnea, and he was like, does he have a big neck? And I was like, what a weird question. But then I was reading about it and I was like, oh, it actually is a risk factor. So thank you for that. What are some of the health consequences? So again, we hear about sleep apnea a lot, and I don't know if everyone takes it that seriously, but it should be taken seriously. So what are some of the consequences of untreated sleep apnea?
For sure, and I think it's really common what you say. Definitely untreated sleep apnea, you don't see it the next day, you see it over a long period of time. So some of those are medication-resistant hypertension or high blood pressure. Definitely, again, that increased risk of cardiac disease or high blood pressure, as well as issues with emotional dysregulation and mood.
And so I know there's a fix for sleep apnea, and one of those fixes is the CPAP. So what is a CPAP?
Yes. So CPAP therapy is definitely the gold standard treatment for obstructive sleep apnea. Now, what people, I've heard all different names for this, CPAC, different names, but it really is an acronym for what the therapy is. So it stands for Continuous Positive Airway Pressure.
This is a CPAP right here.
Yes. So this is kind of what some people look like. There's many different styles.
The snuffleupagus, that's what I call that too.
Exactly. So basically what CPAP is it's a device that takes room air and pressurizes it, and then it's delivered to you through a mask and a tubing like you see here. And that pressurized air really goes into their airways to help to stent them open. So this way it creates a patent pathway for air in and out of the body, and it pushes back any type of muscles that have relaxed due to obstructive sleep apnea. And there are two other types of PAP therapy. So there is one called auto-adjusting PAP therapy, or APAP, where a range of pressure is set that automatically adjusts to the client's specific needs. And then there is BiPAP, or bi-level positive airway pressure, where they set two levels, one level of flow as you inhale and one as you exhale, and typically associated with higher flows.
Okay, and usually it's your family doctor who will recognize that you may have sleep apnea.
Yes.
So once your family physician tells you that you have sleep apnea, what happens next?
Yes, so definitely going to see the family doctor, especially if you're feeling tired or you're having any one of these symptoms. But what happens from there is the family doctor will refer you to a sleep clinic for an overnight sleep study, or something called a PSG, a polysomnographic study. The results of that sleep study will tell us whether you have sleep apnea or not. And that's when then a sleep specialist or a sleep physician will interpret those results and prescribe the specific type of therapy as well as pressure for each individual. And then that is where our journey begins at Wellwise by Shoppers with our customers, because they'll be bringing in that prescription and we essentially would take them through that, explain what it is, give them tailored equipment selection, and really explain to them, what they're going to be doing with the therapy.
And at the sleep study, it can be a little overwhelming because you go there and they're putting all these wires and little like nodes on you, but it's actually a very helpful study. So could you speak to that a little bit?
Of course, absolutely. I think a lot of people are sometimes deterred because, they've heard stories or, definitely there are a lot of different wires that you are hooked up during a sleep study, but all of those wires are measuring so many different types of body systems while you're sleeping. So this is a way for the doctors to really determine what is happening and be able to prescribe you something that would be specific for your needs.
Right.
Yeah.
And so once you've gone through the sleep study, and then a sleep clinic will then likely refer you to a place like Wellwise.
Yes.
So what will happen at the first visit? Because again, like the contraption of the CPAP can also be a little daunting. So what happens at this first visit?
Yes, absolutely. So what happens is our customers will come in and our CPAP consultants will meet with them either virtually or in person. Mm-hmm. We will first do a really good health history. We'll ask them questions regarding their sleeping habits as well as the symptoms that they have, because of course everybody's different. Once we get a better idea of who you are, we will then obviously educate you on the prescription of the therapy, what to expect. Again, select that tailored equipment that we think will work the best for you, and really tell you what you're going to expect in the next couple of weeks. And it's completely normal. I mean, this is something totally new that people introduce to their nightly routine. So it's very normal that, there are questions or concerns that come up, but this is why we at Wellwise, we follow up with our clients really frequently within the first couple of weeks to really address any of those problems that they have and kind of nip them in the bud so that this way they are more comfortable and actual long-term users.
And is the CPAP monitored? Like, is there are you able to see how the person is sleeping and possibly have improved sleep because of the CPAP? Like, is there a monitoring system?
So most of the newer sleep app devices now are, they actually have modems built into them. Okay. And there are these platforms that us as the CPAP consultant can register our clients and see their sleeping habits and see how long they're sleeping and using the devices. So it's a really good indication for us to really know where we can help them or where we can improve or suggest something else for them.
So it's kind of nice to know that, you have the sleep study, someone is looking at how your sleep is, but then it's also monitored, because it is really important to sort of know that it's improving, so
Exactly.
all those health consequences don't show up later
in the future.
On,
exactly. And there are a lot of key things that both us and the sleep doctors will look at from those reports to really give us a good idea, is this therapy working and beneficial for the client?
And so in terms of the equipment in the CPAP, how often do I need to change this equipment, which it's often covered by extended medical, which is also a nice benefit.
Yes, exactly.
Right.
It definitely, a lot of our health benefits do cover CPAP therapy and the equipment. But really the CPAP mask and the tubing, imagine, you're using this every single day and you're supposed to be using it every day. So the manufacturers recommend that every 6 months, the mask and the tubing should be replaced, because with normal wear and tear, they can discolor, turn yellow, create foul smells, and of course develop bacteria and dust particles, which can then lead to skin irritation and allergies, and obviously just be uncomfortable. So as long as you're replacing it on schedule, it should be much more comfortable to use and make you want to use it. There are filters on the devices, so those should be checked monthly and replaced as needed. And the actual devices themselves, they do last anywhere between 5 to 7 years.
A funny tip or story is that my cat is actually obsessed with the CPAP mask, and will often steal the mask, and you'll see the tube just running out of the room. So animals also like CPAP machines.
Yes, I've heard that before.
Okay, so it's not just him. So we've
No.
talked a lot about Wellwise. So what makes the Wellwise experience different, like as a retailer? And most of us are very familiar with the Shoppers brand. So
Yes.
Tell me a little bit more about that.
I think definitely number one is that our CPAP consultants are registered healthcare professionals. So they are registered respiratory therapists like myself, they're registered nurses, and they're registered polysomnographic technicians. So they're really going to be there to provide you that clinical expertise and experience in the field. We also offer the PC Optimum program and Seniors Day discounts. And lastly, we really offer that holistic one-stop shopping. So we have many different products, home safety equipment, supports and braces, continence supplies, as well as mobility.
Thank you. And so my last question is, tell me a little bit about you. So you were a respiratory therapist by trade.
Yes.
How did you end up working in the CPAP world?
Yeah, so I mean, I am a respiratory therapist. I did actually start off working in the hospital setting, and then I moved into the home care setting, and I'm also a certified respiratory educator, so I do try to put a lot of that in my work. I do lots of direct patient interaction as well in my role, but I also supervise 9 of our GTA locations and work with the consultants there, providing any type of support and clinical help.
That's amazing. It's nice to know that, as healthcare workers, you really care. So it's not just that someone's coming in and getting this piece of equipment or service, but that they're being helped by someone who, is well educated in the subject and actually does care. So thank you so much for joining us today. It was a wonderful interview, and I know I've learned more than I had walked in with. So thank you.
Thank you, Natasha.
Thank you.